Hi, this is me, Nida. I know I don't have that many followers, so I will begin with what sort of problems I have. Um, I have PTSD due to immense amount of trauma, extreme amount of trauma. At the age of 30, I'm 36 now. At the age of 30, I was diagnosed with stage 1 autism, which is not very serious, but still you have. Now when I read, I understand why I behaved the way I behaved. um, did it stop me from my education, or I don't know what people think about autism. No, I was actually a very good student until these trauma and yeah, things happened. I have immense amount of anxiety. Anxiety have been a problem since I was a kid. I was very scared, and what can I say? I was scared, and like scared for like nothing. I was a very quiet student. I never did. My teachers never had to say something to me. But even then, when we used to have like parents meeting, I used to do something stupid with my health, which made it impossible for me to follow my parents for this parents meeting, because I was scared to death. I hadn't done anything, but I was scared to death. It can be related to autism. I'm not sure about that. Autism stage 1 is more like a functional autism, where a person can quite function normally, but does have signs and awkwardness, and behaves a bit a little bit weird. I was age 30 when I got to know that, so trust me, those 30 years, now I know why I'm the way I am. So I've tried lots of antidepressants, and you name it. Whatever a psychiatrist can give you, I have tried it. They have, like, literally, there is nothing left on the list of all the medications psychiatrists give out. There is nothing left I haven't tried, and I'm just 36. I'm not young, I'm not saying that, but I'm just saying past 10 years I have tried all of them. And just like other medications, if they have something good, they have something much more that is basically bad. And some are just, they just make you not happy, not sad. These are just passing, really. Now my PTSD is to a level where I normally don't think about it during the days, but I cannot get rid of the nightmares. The nightmares are there every day. They are about the trauma in different ways. It's not the same dream every day, but it's about the same thing every day, every night. So we in Sweden, I'm not sure about other countries. We in Sweden they have launched, it's not ECT. ECT is quite brutal, and you have to be sedated and all that. This is some sort of, it still is giving you these, what is it called? Like electric shocks. Is still giving you that, but you are awake, and it takes 3 minutes and 8 seconds exactly. What it can feel like, it's like, just like someone is pressing, on your head. Some people have more pain. I I didn't find it that painful. The treatment is called RTMS. And because I've seen so many videos about, cancer journeys and many other journeys and, IBS journeys and all that, I thought, why shouldn't I, vlog about this? Because there might be someone out there who is considering this and has a lot of questions. Does it hurt? How does it feel? How does it, yeah, so on and so on. So today was my second session. As I said, it's very quick. Normally, they say that it can take up to 6 weeks, where you have to go daily to take this session. And they place fabric, thin fabric cap on your head, and they do some measurements, and I don't know what that measurement is about, but they do that. And then and it's not painful. The second step is that they try to find they put this device on your head, which give you electric shocks, and then to test that it has it is right place, it is actually reaching the brain. They will be pressing some buttons, and what is happening is that your right hand is supposed to react without you doing anything. You're supposed to just leave your hand like that, and then according to whatever they're pressing, it's reacting. And then when it basically stops reacting, that means that is the sort of the total amount of electricity. I don't know. That's quite complicated, to be honest. I haven't understood it yet. Then what they do is, when they have found that the amount they are supposed to use, what they do is that this device is placed, as I said, over here, and they ask you, I don't know if in other countries it's the same, but where I go, they basically ask me, would you like to just test once, to just feel how it how it feels, and I said yes. So they counted to 3 and they gave me first shock. I wouldn't call it painful, and the thing is, pain for people are so much different. I have gone, like, I was literally scared of blood test and all that, but I have gone through so much in life that pain for me, a lot of people normally react like, gosh, how can you take that pain? Like even doctors have been like, you're not reacting to the pain. But I think the pain I've felt inside has been so extreme that the physical pain does nothing, almost nothing to me. So they did it, and I felt it, and I felt like a small shock, And then they said, okay, this is going to take 3 minutes and 8 seconds, and it will be 20 shocks, and then there will be 8 seconds break, just to let let the brain rest a little. Then again 20 shocks. During that, they place you in a chair, a very comfortable chair, and the procedure starts. It doesn't sound so much, the machine hardly sounds anything. You can feel this part, when the electric shock comes, you can feel this part going up, And now the thing is, I've heard that some people have left this treatment due to the pain. And when asked the doctor, what are the chances to feel better? And that's 50-50. because it's very new. It's a very new method. Um, and it is a bit discouraging to hear the doctors say that no, oh, you will be totally fine after this. When you hear like, oh, you will do this for 6 weeks, but it is just 50% chance that you might feel better or just a little better, and 50% that you won't feel a thing. But as I had taken all the medications, I said, let's do it. Why not? I was scared. To be honest, I was scared. I am scared. What I'm scared of is not the pain, not the procedure. What I'm scared of, that I don't get some sort of, some sort of damage that is long term, or a side effect that is long term. Because medication, you can just stop it, and the side effects, they go away. But this is something, they're really messing with your brain. So today was my second session. It went fine. Basically, for me, I didn't feel any pain. Yes, it was uncomfortable. My son is very, he's just 9, but he is, I don't know how to explain, but even like if I have to take blood tests, he wants to be with me, so he can just, pat on my back and, make sure that mommy is okay. And he's just 9, and I thought like, oh my god, he's going to feel scared, because I'm wearing this white hat and device and all that. But no, he was very strong, and he sit there, and he was just looking at me just to check on me that I'm not having pain. I wasn't giving any reactions because, as I said, it wasn't painful. It wasn't nice. It was just okay. So for those people who are scared that it can be painful, yes, it can be painful for some people, because there are actually different kind of levels of the electric shocks they give. The electric shocks they are giving me is, if you think if 70 is the highest, I am on 43. So that's why my pain is milder. But the nurse said that those who have 70, 70, I don't know what that means, but that can be actually painful. That can, patients do react to that. So now, as I said, it was my second session. I've just explained how it goes, what are the methods and stuff like that, what are the steps. And as I will be going every day, not on weekends, but otherwise every day, and they have a special time for me, and that is 11 o'clock. So every day 11 o'clock I will be going to them. And the first time the cap they made, and they measured and all that, that is saved with my name. So that thing was just for the first time. And now that I go, my appointment took today maybe, I don't think even 15 minutes, 15 minutes, because maybe I was asking too many questions. But this is how it is. It's called, I will repeat, RTMS. Is it helping me? I don't know. It's I have been notified that around 3 weeks, that's when it starts showing, or not showing at all. People can have headache. That's a very common side effect. Yesterday I did not have a headache. Today, until now, I haven't had a headache. But yesterday I was exhausted. Earlier than I usually am. So I was literally exhausted, and I just went to the bed, and it wasn't like exhausted that, oh, I need to sleep. No, it wasn't like that. It was more like exhausted that just didn't have any energy in my body. I just, like I was so I was craving for coffee, and I've been craving for coffee a lot these days. I don't know why, but I was craving for coffee, and you know what? It takes few minutes to make one, but I was so dead. Like I don't know how I was feeling. So what I did, I just went into bed and just, yeah, scrolled the mobile, and even scrolling the mobile was some sort of I can't really explain. I was just too tired. I was just too tired to function. But again, not sleepy, but yeah, tired. So it was hard for me to look at the mobile screen, so I actually put it away. Even that was taking too much out of me. So this is my second session that I'm sharing with you guys, and I have thought that I will be sharing with you guys my journey. Of course, it will not be every day, because I don't know if I have something new to update every day, but if I do have, of course, then I will make a video. But I will be making videos like every 3-4 days, you know, telling how I'm feeling, or if I'm noticing any good or bad, whatever I'm feeling right now. As I said, apart from that exhaustion, I had no other side effects, and I did today this session 4 hours ago, and right now I am starting to feel tired. But I was so determined that I really need to make this video, because like I couldn't find so much. The little I found was actually even scary, and then there were few that said nothing, they noticed nothing, and then there were few that said like sort of a difference, but I couldn't find any wow review that that it was the best thing they have done, and they recommend it to everyone, and not even the doctors and nurses are saying that. But because I've tried all the medications, that is my only option. Otherwise, I will go back to the medication I was taking and basically live the way I lived, with depression, anxiety, and all that. So I am giving it a chance. I am scared, not for the pain or anything. I'm very scared for the future. So 6 weeks it is. It's a long period. But as I said, I will be updating, because I myself couldn't find so much about it, and I really love when people even go through cancer journeys and all that, when they vlog and they show the actual, you're not just reading facts, you're actually hearing it from a patient who is going or who has gone through this. That is when you connect more. And if you guys have any questions, as I said, this is my second session, and I will be asking them questions because I am very curious about this. So if you want me to ask any question, or if you want to ask me any question, you're more than welcome. I hope I at least gave some little kind of information to you guys. And I wish you a very nice day, and I love you lots and lots.